Like, yeah, they don't like their dandruff, so it's a suffering. And then there are all these not medications, there's shampoos out there to try and deal with it. What are your thoughts on? We're jumping right in.
Yeah,
What
good
is
morning,
dandruff?
everybody.
Yeah, is it really dry scalp? Because then we talk about
It's
people
not
who
dry
have
scalp.
oily hair.
That's right. That's dandruff.
Yes.
Dandruff
Oily hair
isn't
is
actually
dandruff?
curable. Dandruff is more of a chronic condition. Usually, if you have dandruff, it comes and goes, but you always have dandruff. Dry scalp can be temporary, just in the winter, and it's very easy to get rid of. Dandruff's a little more persistent.
Yeah, and there's a couple ways you can tell the difference between if you have dry scalp or if you have dandruff, which is important because that tells you how to address it. Dry scalp usually has smaller flakes, and the scalp is indeed dry. And also, if you have other dry parts of your skin on your body, that's a good indicator too. With the dandruff, it can be oily feeling. The flakes are usually larger. They can be yellowish, and that can be remedied with over-the-counter shampoos. But you need to know that if it doesn't get better with the shampoo within a couple of weeks, you should see a dermatologist because it could be something like psoriasis.
Psoriasis
And
of
you
the
need to
scalp.
differentiate because they're both treated very differently.
Yeah, yeah.
Usually, if you put moisturizer on in the evening, you get up in the morning and you shower, and the flakes are gone, it's dry scalp. If it persists, it's dandruff.
What kind of moisturizer are you putting on your scalp?
Well, you can use everything, even like your face cream, if you rub it into your scalp, and the next morning you shower, and you don't have any more dry, flaky skin, good sign that it's just dry scalp and not dandruff. Dandruff, like Elizabeth said, is actually an oily scalp, so you're not going to want to add more oil.
Yeah. Oily scalp is, yeah. And all, but can you tell, oily scalp, oily hair? Like when people are,
Yeah, I mean, some people produce
no?
more oil than others. So if you have oily hair, it doesn't mean that you have dandruff. But if you do have dandruff, then your scalp is more than likely going to appear oily. Yeah.
And it's probably going to be itchier.
Yeah. Yeah.
Okay.
You can experience itchiness with both dry scalp and dandruff. So that's not necessarily an indicator of dandruff.
It's very hard to tell in the winter because everyone's scalp is a little drier, a little itchy, a little flaky.
You said that I thought, like, in the winter my hair is not as frizzy. And Tim, you just said, no, in the winter your hair can be frizzy. And I was surprised by that because I'm looking at the total, lack of humidity on the northeast, up in the northeast versus like when I go down in New Orleans and it's more humidity. Although even now they probably have some colder temperatures as well. But you know what I mean? I thought humidity is what the thing that makes my hair frizz, not cold.
For you, yes, but dry, dull, it's going to make your hair a little frizzier. Wearing the caps, the wool, the cotton, all those heavier fabrics cause your hair to frizz and cause breakage.
Well, and there's a lot of funky things that happen with static electricity, where we're moving when we're wearing hats and coats and scarves and things like that. We're moving the moisture, well, sort of, to the fabric, and that's taking away. And then we have this electrode thing that's happening, and the hairs separate from one another, and that's how the static occurs. It depends on hair type and texture. I would say, frizzy hair does frizz up in humidity. Finer hair tends to be really troublesome in the winter. Finer hair can be prone to being drier, and if it's drier, then it really doesn't have the moisture, and that's when you get, these weird things going on with the...
When I was a kid, I had very long hair, and I mean, like mid-back. And that used to get...
You came to me.
Yeah,
I
yeah.
remember.
Yeah, well, yeah. And I feel like I had more problems with static then than I do now. My hair is so much shorter. It's still, if I pull off a hat or a scarf and I'll get a little, you can hear it. But it's, in general, not nearly as often as it was back when I was a kid.
That's interesting. Did you live here?
Yeah.
That's interesting. Well, hair textures do change over time too.
Yeah, I didn't know if it was just, I don't know, the length or I'm not sure. I don't know, but it was interesting. You're just talking about hair static. You see those pictures, your hair's out like a fan behind you as you take off your hat or something. That'd be like how it was. You guys who are listening, you have questions for our super duper hairstylist, you certainly can give us a call. It's Tim Johnson, Elizabeth Maloy, from the Eve DeRee Salon, which is on the Upper East Side in Manhattan. You can give us a call, 1-877-NYU-DOCS, 1-877-698-3627, or email us, docs@SiriusXM.com, and we're going to take a couple of phone calls. We're going to go to Jessica from St. Louis. Welcome to Dr. Radio. What is your question or comment for us?
Hi, mine is regarding hair loss. So, like about 2 years ago, I went through the stage where I naturally have fine, thin, blonde hair, and it just was like falling out in clumps. And I was kind of told by someone that I had telogen euploidium, I think, where you like go through the stage where you just don't grow much hair. And then I also found my ferritin was low in like the range of 12 to 20. So it's still normal, but low for hair growth. And I didn't highlight my hair, and I did really well for about a year or two. And then recently, last month, I got subacute thyroiditis. So my TSH is really low, and I'm in like a hyperthyroidism state. And now it's like just falling out, like I can't stop it, and I'm on prednisone. So I take biotin. I try to minimize the amount of washing and shampooing I do, but I exercise regularly, so I feel like I have to shampoo daily. Do you have any thoughts on what I can do, like, or vitamins, or what your thoughts on that is?
That was a mouthful. That's a lot. I'm so sorry. I know how sad that can be when you're losing your hair. It sounds like you've done everything, and I commend you for going to the doctor and actually doing the research. So at present, is your hair still falling out?
Yeah, so like if I shower and I comb, like usually, you lose hair, but now it's just like every piece I'm getting much larger amounts.
Mm-hmm. And did you say this was initially due to thyroid?
Well, 2 years ago, my thyroid was completely fine, and they couldn't really figure out. The only thing that came back was my ferritin was quite low. My iron levels were fine. Like, I wasn't anemic, but my ferritin seemed to be low, and the dermatologist said, well, take iron, and that really seemed to help. And then recently, my thyroid seemed to really play a toll on it.
Okay.
Yeah, I mean, certainly you have low thyroid now?
Yeah, right now my TSH is like little to nothing. It's really low.
No, well, your TSH being low means that you have high thyroid. I mean, what are you taking thyroid medication?
No, it was subacute thyroiditis, so they said it was caused by a virus, and it takes 4 to 6 weeks to you'll eventually go like normal, and then you may go hypo again.
Okay. All right. Just because if your TSH is low in general, that means your thyroid is functioning well. No, it's not. So it's it's high. You're putting out a lot of thyroid T4. There are certain situations when that's not true, but in general, if your TSH is low, it's a feedback. Your TSH is high, it's thyroid stimulating hormone. It's stimulating your thyroid to produce more thyroid hormone. And if the stimulating hormone is super low, that means your body stores are pretty high. So and I mentioned earlier that I am myself. I take some thyroid medication, and then there is some variability in the amount, in the level. So my TSH sometimes is 1.9, and then I'll check it another time, and it's like 0.2. So it can be, it can vary over the course of a time period that you're checking. But when it's low, it means that there's adequate. And just so everybody is aware, your TSH level, again, it's thyroid stimulating hormone. The range is so broad, which is part of the problem of it, but it can go from 0.4 to 4.4, and in some cases 4.8. So when high and low is the range of normal is so broad. But if it's super low, less than 0.4, then that means you have a fair amount of thyroid around. Did you try, Jessica, any like biotin or folate or zinc or any of those things? Did you take a hair and nail vitamin?
I take a prenatal, and then I take biotin 5,000 daily.
And okay. So, we did a show a while back on another vitamin. I do recommend it. It's based on scientific research. I don't have any ownership in the company. I'm going to put that out there right now. The company, there's a couple of them, but this one's called Nutrafol, Nutrafol, and it's for men and women. And most of the people take it, and I've had some patients that take it because obviously my patients have, since I do weight loss, they have significant weight loss, and when that occurs, they can lose some of their hair as well during that time frame of rapid weight loss. So the Nutrafol seems to make a difference. Matter of fact, I had a patient who always had thin hair before surgery, and immediately after the surgery, when she could start taking a big pill, because multivites are kind of big, I'm just saying.
Yeah.
As soon as she started taking it, what's happened now is she's over a year out. She's been on it. It's expensive though. It's like at least $88 a month. Sometimes there's specials or whatever, but you can get it online.
I have a bottle at home.
Oh, you do?
But I haven't started it because I'm trying to get pregnant too. Because I think there's an ingredient in there that you can't take if you're trying to get pregnant.
Oh.
Well, anyway, that one.
I think it's saw palmetto maybe or something. I don't know.
But I'll say this about her hair. She was like, "Can I stop taking this expensive vitamin?" And I just looked at her for a second because I was trying to remember. And of course, your memory's all, I think I have a decent memory. I'm looking at her. I'm like, "Dude, isn't your hair better now than it was before surgery?" She's like, "Yeah." I'm like, "Well, then don't stop," because she had really thin hair, and now it's still thin. You could still see her scalp, but it still was more full than it was in the past. So I do think that it does work. What was the other thing that people have used for hair loss? And it's also expensive. Viviscalin or
That's another one, yeah.
Viviscal? Mm-hmm. Yeah, and I find, I don't know. I think I like Nutrafol better, but people have had success with Viviscal. What do you guys, have you seen that?
We're fans of Nutrafol. I'm a fan of Nutrafol. We usually promote that at the salon. Jessica, have you spoken to your doctor about the ingredients in Nutrafol?
Yeah, when I first went 2 years ago, the dermatologist, she's like a hair specialist, and she recommended that she sells it in office. And then, but we're trying to get pregnant and going through IVF. And the last time I went there, she goes, "Oh, you can't take it if you're trying to get pregnant." So.
Okay.
Okay. Well, if you get pregnant, you'll get lots of hair.
Hopefully. And it really sounds like you're doing all the right things. I tell people if they're going to go see a dermatologist for scalp stuff, they should see someone that specializes in that, because dermatology can cover such a wide range. And then one other thing I just wanted to comment on, you brought up really quickly at the end there that you're shampooing your hair every day. I wouldn't worry too much about that. I just read recently about a guy who washed his hair 4 times a day for a year, and his hair didn't fall out. So I think you're fine
doing it. I always tell my patients though, just to make sure they got a fresh cut, that it's shorter, because I feel the weight of the hair can certainly pull it out. I lost a lot more. I've always lost a lot of hair. I have a lot of hair. You guys say it's normal to lose 100 to 200 hairs a day?
Yep.
Yeah, I was easily on the upper end of that, 200 hairs. Like my first time I was, I didn't really go to hairstylists before. Like we would just line up and they would just basically trim the ends, like, because we were not looking to style the hair. I just had long hair and just cut the ends. But when I went in college, the girl was doing my hair. She's like, "Is there something wrong? Because your hair's just falling out." And I was like, I looked at the floor. I'm like, "No, that's how much comes out every day." She's like, "I don't know. You miite need to see a doctor." And I'm like, "I think this has been going on all my life." So, but 200 hairs a day. But I think it certainly is much less now because it's much shorter, my hair. So that might be one thing also to try, Jessica. Thank you so much for your call. We're going to Lynn from Texas. Welcome to Dr. Radio. What is your question? Again, I have Tim Johnson and Elizabeth Maloy here. I'm Dr. Marina Kurian. What's your question for us?
Hi, it's kind of a similar question. When I was a teenager, I was at the salon, and they noticed a little spot of alopecia, and I went to a doctor, a dermatologist, they gave me some sort of steroids, and literally within a week, I looked like a chemo patient. It was awful. And finally, it all grew back, and I would kind of get a patch here and there, and it would kind of clear up on its own. So fast forward now to adulthood, I had endometriosis, had surgery, was taking Lupron to kind of suppress my hormones and things like that. And after the surgery and after getting off of Lupron, I feel like it's a marked hair loss, kind of in the back, like kind of how older ladies have that sort of patch in the back. I feel like it's kind of coming on, and I'm only in my late 30s. And like the previous caller, I'm also trying to get pregnant, so I was wanting to know what types of maybe vitamins or treatments I could pursue, and is that normal for someone my age because of surgery or medications?
Because of surgery? Definitely. How long ago did
Absolutely.
you have surgery?
Like, it's going on almost 2 years now, and I feel like it's still...
What
yeah.
surgery was that again?
I had, not laparoscopy, where they had to go in further.
Oh,
even
yeah, no.
further, and-
When people talk about hair loss after surgery, for weight loss surgery, it's very dramatic and occurs from 3 months after to 9 months after surgery. When people talk about hair loss in general after a surgery, they seem to blame the anesthesia. And what happens is it's usually at 3 months after surgery that it occurs. But since anesthesia is like a one-time event, first of all, I don't know how much research is there about the anesthesia related, but your hair loss should not be related to your anesthesia and or procedure, 2 years ago. No, because what's the life cycle of the hair? I always want to say it's 102 days or something, but it conflicts with the red blood cells, which I think are 120 days, something like that. So
Is that right?
Yeah, I think it's somewhere in between, right?
it's 100, yeah, we're going to look that up and get back to you. But so that's why, having the anesthetic agents on board, et cetera, is felt in some instances to result in hair loss 3 months later, because it's after the hair cycle. So the hair that's there feels it, and then, and you have some loss. Lynn, do you still have alopecia?
No, but typically what would happen when I get a little patch or something, it would come back. And my latest patch that I had really kind of didn't come back. And so it's kind of alarming. And also I wonder if it's hereditary, because I have an aunt on my mother's side who, like, you could see her scalp. Like, when she was elderly, she almost didn't have any hair left when she was in her 60s and 70s.
Yeah, there certainly is. Again, that's really a question for a hair specialist or a scalp specialist, which are usually dermatologists. But, sometimes when you see a patch here or there, depending if you go see them, sometimes you can use the foam minoxidil and things like that. It's just, that is definitely not my area of specialty. But if you see someone like, Tim has seen me, every once in a while I get a concern that I'm getting like a little patchy area on one side where you see the scalp a little more, but it's just, I don't know, like, what do you tell clients when they come in and they're concerned about that?
A couple things. So, hair growth, all of our body is cyclical, right? And sometimes patches come and go, quickly, and then sometimes they take a long time, and then sometimes they never fill in, and that's just somebody's body. Sometimes things are unpredictable, and that's just the way it is. And then as far as things being hereditary, the idea that baldness came from what is it, the father's side or the mother's father, something like that. That's not actually the case. We say it so much that we've just come to think that it's true. In reality, it is hereditary, and it can come from anywhere. So. That's just the way genes work. Sometimes things show up. And, 30 seems awfully young. Are you sure that, in the back there, your hair hasn't just kind of changed growth pattern? It's just doing like a swirl kind of thing?
Well, it is sort of like a part now there that I just never had before. And I just noticed that it just, I don't know, I feel like there's more hair on the bathroom floor after washing and brushing, and So I just want to be proactive about it. I was thinking maybe I need to try minoxidil, but like I said, again, I am trying to get pregnant. So I don't think that that's advisable at this time.
Okay. Maybe speak to your doctor about the Nutrafol or any type of supplements that you might be able to take during the pregnancy.
Yeah, Len, thank you so much for your call. I hope what we were talking about is helpful, but definitely see the derm again, I think. Again, and for everyone, it's Nutrafol, Nutrafol, right? Nutrafol. And you can just Google it. It's one for men, one for women, slightly different. But check if you're trying to get pregnant, as two of our callers.
Yeah, I know.
try and check with your doctors, your OBs and stuff. Have them look through and see if there's any issue.
The other one was Viviscal.
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 Yeah, we did a show once where somebody called in and said that they did their daughter. Do you remember the show? The daughter had lost all her hair and that she gave her spirulina.
I don't
And
know.
it's like a blue algae or some kind of
Yeah.
treatment, and it really made a difference for her hair. It was like some unexplained reason she lost her hair, so I'm not sure if it was related.
Is that kelp?
Yeah,
It's like
Kelp
a-
is
it's
really good
seaweed
for-
based, yeah.
Yeah,
Yeah.
It actually does promote
it's a
healing and
specific
growth.
type of blue algae, though, if you
Yeah.
Google it.
It's the iodine.
Is it? What, that's good? Oh, interesting. All right, let's see. We're going to take another caller. Josh is calling from Florida. Welcome to Dr. Radio. What is your question or comment for us?
Thanks for taking my call. I've got terrible flakes. I have them on my head. I have them on my beard. And additionally, sometimes I'm scratching up there, and I find a little scab that I pick off.
Oh.
I know it's kind of gross.
No, it's not. It's just, it hurt me just thinking about the scab.
Yeah.
But because,
I don't know what it-
think about when it was on your knee and stuff and you used to rip it off. It was like a
Right.
pleasure pain thing, but then it was, it's kind of, right? Yeah. But, Josh, so the question, I would say, if this is going, and you're getting, are they big scabs? Are they small?
No, they're real small. They're real tiny.
Yeah, you guys take this, but I just worry that, just keep in their mind that it could be like a psoriasis or something.
That's
You
right.
should
Yeah.
see a dermatologist. But if this is not like some quick fixes, you guys, that he might be able to try right now. And you've tried dandruff shampoo?
I do. I use T-gel, and I think it does an okay job, but I still have flakes. It certainly helps a little.
And why did you settle on T-gel versus remember Selsun Blue and what's the other one? Head and Shoulders and all those. They all say they're medicated shampoos.
Right. I tried them all. The reason I went with the T-gel is that my wife does have psoriasis, and she uses it. And she said I should give it a shot, and I did. I don't know if it works better than any of the others. I just use it because it's in the house already. But it helps a little, and at least as much as Head and Shoulders and Selsun Blue and the other one that I tried. And I tried them all with the different ingredients, the selenium, the salicylic acid. I just don't seem to get any relief, and it seems to be, as odd as it sounds, related to Florida. I never had this when I lived in Texas, which is a much drier climate. But
there
in
is-
Florida,
There is one factor that I failed to mention when we were, covering dry scalp versus dandruff, and that is contact dermatitis. So contact dermatitis is just your body having an allergic reaction to something topical, or contact that's topical. So it could be something as crazy as your water. Or the soap that you're using, something like that. It could be just irritated. There is a chance that could be the case, and that could be hard to figure out what it is, unfortunately.
If it is dandruff or something more extreme, it doesn't go away entirely. How long have you been suffering with this?
since I moved here, it's been about 10 years.
Okay. So it's probably going to be an ongoing problem for you. You have to find the right shampoo. I recommend, as a remedy, baking soda and olive oil will immediately make your scalp feel better. It'll help the sores. It'll take care of the dryness, and it's also an antifungal. So it's
Is that like 1-to-1?
1-to-1. Massage it into your scalp. Leave it on 15 minutes. You'll immediately feel better.
Okay, I could do that.
Yeah, it's easy. You have to keep doing it, though. It's a condition that's probably not going to go away.
Got it. All right, I'll give it a shot. I appreciate your help.
Okay, and also, get a see your doctor just to make sure it's dandruff or something more severe, so you know how to treat it.
All right. Thanks, Josh. Thanks for calling. Now, this is not a time for apple cider vinegar, which we love all the time.
Actually, that's good for everyone.
It is.
Yeah,
You know what my big kick is lately? Castor oil.
yeah.
Oh, I love it. I love it. I use it as a scalp treatment personally.
I've heard, isn't there like a black castor oil that's supposed to be really
Oh,
good?
I don't know. I have to find that out.
See, get you two together in a studio, even though you work in a salon together. You see, now black castor oil. Wow. Huh,
Someone
interesting.
mentioned it to me, yeah.
That sounds scary. Castor oil is made, or made from the same stuff you can make cyanide with. So if it's not prepared right, you could, kill yourself.
Oh,
Oh,
Anyway,
that seems
moving on.
dramatic. That seems a little dramatic. Let's not. All right, Josh, thank you so much for your call. We're going to Dorinda from New Jersey. Welcome to Dr. Radio. What is your question or comment for us?
Hi. I have a son who just turned 17, and the woman who cuts his hair gave me a call to tell me the last 2 times she's noticed his hair was thinning. So he's now 17, and we took him to the doctors and got blood work done to make sure, all his vitamins were okay, and they were. However, he has receding hair in the front and the bald patch on the top of his head. You could definitely see, especially as mom, I noticed. And we have subsequently put him on a Rogaine he started using. But my question is, do you suggest any vitamins? I mean, he's awfully young. My husband started losing his hair when he was 20. But at 16, it seems awfully young to start losing your hair. And I was just wondering if you suggested any vitamins or supplements.
Well, we talked about Nutrafol before. It is supposed to be. He's 17. Yeah, I would show the ingredient list to his pediatrician and or whoever's seeing him and see if there's any issue. From what I remember, looking at the back of it, there's not really anything in there that would hurt him. But you should verify that with the doctor. And the other thing is, when you say you took him somewhere, was it to a dermatologist or a scalp specialist? How deep did you go to address this?
Just to his pediatrician, and upon his examination, he didn't see anything awry with the scalp. There didn't look, doesn't look to appear to be any issues with dry skin or anything like that.
I would go to somebody who's a specialist in scalp, and if you could look up a dermatologist specializing in scalp treatments or scalp or hair loss, dermatologist specializing in hair loss in your area. I would do something like that just to get another layer of intel.
Also, just wanted to mention that when hair loss occurs, I think there's a window of time that you can kind of spark regrowth, and then after that window, it's sort of, I'm trying to look for the word. It's not scars up, but it just kind of closes up, and then your chances for revival are over. So, I think the
It's only been a year, so the sooner you get moving on it, it'd be better.
Yeah.
Okay, so the one other thing, we had a comment from another caller for Josh, I think that was his name, right? Mm-hmm. Was that it could be the well water that is causing his flakes. Interesting.
Yeah. I have a feeling it's the water.
Mm-hmm. All right, you guys, we do have to go to break. And when we return, again, those of you who are listening, feel free to give us a call at 1-877-NYU-DOCS, 1-877-698-3627, or email us, docs@SiriusXM.com. And I will return with Tim Johnson, Elizabeth Maloy. I'm Dr. Marina Curran. We'll be back in a couple of minutes. SCJ to start up their day. All right, you guys are listening to Dr. Radio. I'm Dr. Marina Curran, and joining me in studio, Timothy Jackson and Elizabeth Maloy, both stylists at Eve Jarif Salon. Elizabeth also does eyebrows.
I do.
Yeah, she's quite good at it.
Oh, thanks.
And hair and color. These guys are very versatile. And we've been talking about dry scalp and winter hair. And you guys who are listening, if you're interested in joining our conversation, you give us a call, 1-877-NYU-DOCS, and that is 1-877-698-3627. Or you can email us your questions to docs@SiriusXM.com. And we're going to take another call. Mark is calling from Arizona. Welcome to Dr. Radio. What is your question or comment for us?
So during the winter, my scalp becomes kind of itchy, and it seems like if I brush it, it gets itchier. So maybe I'm overstimulating my scalp with this brush. What type of brush should I use?
Do you have long hair, Mark?
No, it's relatively short. It's maybe 3 inches long.
Okay, so avoid plastic. You should be using natural wood or organic fibers of some kind. If you're using plastic, that's probably part of the problem.
Yeah, boar bristle's always good. That's a safe bet. And I personally think that stimulating the scalp is always good for it. Of course, you can overdo in all things, right? But I can't imagine brushing 3 times a day or something like that would stimulate more dryness or more itchiness.
Yeah, I think when you wash your hair also, you guys always talk about, certainly when you go to the salon, there's a massage element, but even when you wash your hair at home, you're supposed to massage your scalp to stimulate it. And
Absolutely, yeah.
Very
but how
Get
long,
that
like,
blood flow going.
yeah, and so that might help, Mark. It might help normalize when you brush, you know, what's happening. And you don't have any dandruff or any issues like that?
No, not really. Maybe very small flakes every now and then when it's dry, but not dandruff.
And
I
you
don't think it's
mentioned
dandruff.
you're in Arizona, correct?
Yes.
I mean, it's super dry there.
Yeah, true. And I never use a conditioner. I never moisturize
Oh, well, there you go.
my scalp.
Yeah, why
it's-
don't you give that a try?
Yeah, perhaps I will.
All right. Well, thanks so much for your call, Mark.
Yeah.
So when should the question is, and this is very interesting because I never realized people would be like, there's the water running, you're getting your hair washed, the shampoo, and then you hear, and I'm like, what? And I'm like, what? And it's always, do you want us to put the conditioner just on the ends or all over? And I'm like, oh, I didn't know it was a thing. Like when I do it at home, conditioner goes in my palms of my hand and it's all over my head, not just on the, not just on the ends. And I was like, is that a thing? Because then I started thinking, well, should I put it on the top of my head? Because it gets a little frizzy there. So I end up, I don't know. I think parts of my hair miss the conditioner and the other do because now I'm just confused by it. But so what is this fear of putting the conditioner all over? It makes your hair too heavy, look too greasy, but not my hair. Like
Not
some people's hair.
Exactly. It depends on your hair texture. Although typically you would apply the conditioner to the mid shaft of the hair to the ends and go a little bit lighter, if at all, on the scalp. And you should know that if you're coming to our salon. We have a very specific technique.
I know.
Using the Eve to
I'm not talking about when I come to I do go other places sometimes. Sometimes a girl needs her hair blown out, and then you just sort of like, what did you say?
Well, all right. So, there's something that happens to the hair that we call the weathering of the hair, and that is, as hair gets older, it's exposed to,
Were you looking at me? It's hair. It's like, this is a life cycle of like 100 and something days. I'm looking this up now. Not
Yeah,
100
I'm
years. Not 50 years, okay?
trying to find that. But, and especially if we color it and things like that. But you have to remember, hair does get kind of beat up as it gets older. And when it comes out of the scalp, it's brand new, baby clean, like healthy hair. And so I think the idea is like, why condition that? It's pristine, it's new. So I think that the ends are what need the attention the most because they're the oldest and they've been through the most. And I always suggest to people.
Okay, you were just talking about the life cycle of the hair and not saying that older people have different. That's what I was talking about. I'm like, hang on a second.
No.
Here.
I mean, somebody who has hair down their waist. I mean, think about it. Their hair is probably it's probably like 10 years old.
Yeah.
So I suggest to use the conditioner on the ends first, work your way up, instead of globbing it on the top of your head.
and gently comb it through. Never rub wet hair.
Oh, be super gentle when it's wet. Hair is so susceptible to breakage when it's wet.
You know what? I just looked up the hair life cycle. It's saying it's 2 to 7 years. I don't believe that. I have to figure this out.
Well,
That's about right. I
that
think
sounds
so. Yes.
yeah, because I mean, if hair grows, what is it, like an inch every 3 months, roughly a centimeter a month, something like that?
No, it's a quarter of an inch every 3 weeks. So what is that in?
Quarter to half an inch a month.
Yeah.
Wow.
So if someone has long hair, think about how long that took, right? And the hair has to stay in the head for that to happen.
All right, well, so this 102 days, I must be thinking it's 120 for the life of the red blood cell. I'm sorry for the misinformation, people. I always thought this was a much shorter reason for the hair to pop in and out. All right, we're going to take another call. Olga is calling from Ohio. Welcome to Dr. Radio, Olga. Again, I'm Dr. Marina Curry, and I have Elizabeth Maloy and Tim Johnson in the studio. What is your question or comment for us?
Hi, I have a question. So I'm a female of 60 years old, and I'm using Rogaine for the last 3-4 years very successfully. So I use 2% Rogaine for women twice a day. My question is, can I use instead once a day Rogaine for men? It's twice of concentration of the same ingredient, but I don't know what the difference would it make, if any.
That is a good question. You said it's been very successful. Why do you want to switch?
It's good to send twice.
What?
And it's,
Oh, because you have to apply it twice.
yeah.
Oh.
I
It's the
see.
same course, and plus I have to apply it twice.
Okay, I see. I don't know. Any thoughts about that?
That's a tough one. I'm not quite sure.
You know what, Olga, what I recall from doing other shows, and is that women tend to respond to Rogaine, depending on the pattern of hair loss, etc., quite well. And my general feeling is if you're happy with it, which is, it's so hard to be happy with your hair. I mean, I just think if you feel like you have a problem with your hair, when you're finally happy with it, I wouldn't change it. You can talk to a hair specialist, usually a dermatologist or one of these, I have a friend who works for Bosley, and you can ask them as well. Maybe even a plastic surgeon might be able to help you with that to see if you can switch. Because I think, I wouldn't want to switch and then have you have an unhappy result, and then you go back to it and you still have an unhappy result. You know what I'm saying? I feel like if it's working, don't mess with it.
Mm-hmm.
What's the expression? If it ain't broke, don't fix it. All right, Olga, thank you so much for your call. And we have callers just calling in to comment. That's lovely. They don't want to talk to us, but they're going to leave comments for us. This is great.
I like comments.
Yeah, one of them is talking about laser treatment, hair max, and worked for hair loss. That's true, too. I was going to say, just like they have those, the laser light stimulation, or these caps and things to stimulate. I've seen some of those things online. Back when we had Sky Mall, come on. Who doesn't miss Sky Mall? I totally miss Sky Mall. I learned so many things, new items that were wow. I would sit there and be like, what, we're landing? So take it with you. Yes, I want to take this with me because that's so much information.
Well, that's what I was getting at with that window of time. If you notice hair loss, things like a laser can work. It varies from person to person. But if it's been, 7 years since you lost your hair and now you want to try it, your chances aren't going to be great. Yeah.
All right, let's take another call. Lisa from Michigan, welcome to Dr. Radio. What is your question or comment for us?
Good morning. I was calling in response to the last lady asking if she could go to the men's Rogaine.
Mm-hmm.
And on the dermatology show, they recommend that. And I've been doing it for 2 years, and my hair is growing like crazy. It's I'm 56, and my hair is almost to my waist and really thick.
Wow.
Oh, good.
Thanks
There
for
you
sharing
go.
that with us.
Yeah. See?
Yeah.
That's right. We do have it. That's right. We do have a dermatology show. they talk about this, so that's great. And so doing it once a day didn't change anything, or you always started with the male Rogaine?
I always started with the men's. I use the liquid. I put it in a little spray bottle, and when my hair is wet, I just spray it. I make parts and spray it in the parts
Amazing.
of my hair.
Well, Olga, if you're still
I did-
listening, there's your answer.
Yeah, why not try it?
Question about the black castor oil. I wanted
The
to
mystery.
I wanted to try that like at night to like moisturize my scalp, but it's so thick. How do you get it?
Oh, okay. I'll tell you exactly what I do. So I get a little.
You're not using black castor oil though.
I just use I didn't know black castor oil existed.
Yeah, I just
heard
looked
it's
it up.
amazing.
It's Jamaican mango and lime black castor oil or tropical isle Jamaican. It's all Jamaican.
Okay.
Jamaican. Okay, there's a lot of this. But yeah, they're showing the before and after pictures are just it's hysterical. Hub.
Oh, Google.
They want you to buy. Yeah, Google. But you can get it on Amazon.com.
I use regular old castor oil. It's like $8 for a huge bottle. It lasts me forever because it is super viscous. It's very thick. So I put it in a small bottle that has like a pointed nose to it, and I put in a few drops of rosemary oil and I mix it up. Don't use too much because rosemary
It's like a salad dressing.
Yeah, it sounds great, right? I would not recommend eating castor oil. But anyway, then I will just apply to the roots and kind of massage it. Oh, wait, I skipped a step. You have to get it warm. So, make a pot of like hot water and then put the bottle in the pot, something like that. That's
This
how you
is
get
like,
it warm.
see, Elizabeth, this is what you do with baby bottles when you're trying to heat milk.
Same,
Yes.
exactly. Same type of thing. So once it's warm, it'll be easier to work with. And then I massage in the scalp, leave it in for 20 minutes. And before you go to wash it out, use shampoo on your hair dry. That'll be easier.
Like dry shampoo, or you mean?
No. Use shampoo on your dry hair because that'll help break up this thick oil. So, and then you can rinse it out. And then you can do like a regular shampoo. But that part's very important or else you won't be able to get it out.
Don't use Dawn.
Did that make sense?
Do you know what I'm talking about? Dawn?
Yes.
Yeah. Dawn is so great.
Yeah, it gets oil off everything.
Oil off
Don't use Dawn on
everything.
your hair.
No, don't use
Talk
Dawn on
about
your hair.
static. Oof.
Yeah. Strip your hair down, but it's good.
Okay, so
At
did
least
that help?
I hope that was helpful. Thank you so much. And thanks so much for calling to let Olga know she can switch to the male Rogaine.
Yeah.
There you go. We're going to go take another call. We're going to Summer from Washington, D.C. Welcome to Dr. Radio. What is your question or comment for us?
Hi. My question is I'm 37 weeks pregnant, and my first pregnancy, I lost a lot of hair. And I know it's, it has to do with hormones and everything, but I was wondering, is there any way I can kind of tackle it, like third trimester?
Are you going to be breastfeeding and stuff?
By the time I'm postpartum, I don't have to deal with all of that. Is there any supplements that I can take? Or
Well, you have to check with your OB. I'm sure this is a question that they get all the time because I'm not sure if you can take, biotin. It depends on if you're going to be breastfeeding or not, and just you have to check with them to really be sure. But if you're not breastfeeding, then yeah, all of the options are open. But if you are, then I would check because that stuff does get, vitamins you take does get transmitted into breast milk.
Okay.
It's mildly traumatizing, but your hair will come back. You just had a baby a few months ago?
No, she's 37 weeks now.
Oh, okay.
Yeah.
And you're,
So she's trying to
Prevent.
Oh, I
You know,
understand.
It's it is interesting. If the life cycle of the hair is 2 to 7 years, why you lose so much of it? It's just the ones that were ready to go are like, no, I'm hanging in there.
They're
for
just
You
9
literally
months.
stop shedding during that period.
Yeah,
and then
yeah,
it all
yeah,
just
yeah.
sort of comes out, and it feels like you're going bald. But
So that 100 hairs a day that you usually lose, you may not be losing that much. So while you're pregnant, you have all these great things happening to your body, and your hair just doesn't fall out. And then, of course, it all falls out at once. So it's just something that happens. But do you have a regular hairstylist that you like to see?
I do, yeah.
So when I have a pregnant client, what I usually do is do less layers. I have like a nice blunt haircut so it feels fuller in preparation. That's one of the
interesting.
things you can do. Yeah.
That's a nice trick.
Yeah.
Thank you so much, Summer, for your call. We're going to Suzanne from Florida. Suzanne, welcome to Dr. Radio. What is your question or comment for us?
Hi, I have a question for your guests about their experience with redheads going gray, or do redheads go gray?
I love this question. It's exciting. I'm going to learn something here. I'm just sitting here now.
Tim?
I've
Yes.
seen both.
Yes, redheads go gray.
But then is there anything special? Like, like Tim's been telling me, I see Tim periodically, that the back of my head is completely gray, which I'm not really happy with his discussion about my hair, because in the front I still have like salt and pepper. Mm-hmm. Of course it's all blonde because I'm letting my natural blonde highlights shine through all of this. But for a redhead, when they go gray, is there anything special they have to do to protect their hair or make it more gradual, or is it really sort of individual? And does it depend how red it is? Because you have this auburn hair, and then you have like lighter, like more ginger hair.
Yeah, it's very individual. Suzanne, are you coloring your hair now?
No, my hair is like really bright orange red. My dad had red hair. He went bald, but what hair he has left is like cornflower color.
Yes.
His mother, I never saw her go gray. The red got kind of muted and went more towards auburn. But I have two friends who have red hair, and one of them turned white almost overnight. And the other one is going that way as well. She's like turning white.
Well, I want to know, what is this like? You have like a little redhead coalition going on.
Yeah,
You know, okay?
Redheads
are actually like 1% to 2% at most of the population, and it's decreasing.
Mm-hmm.
Decreasing, yes.
They're a dying breed. Yeah.
I did not.
Well, that's not what I was saying. It's decreasing. Elizabeth.
Sorry. In my experience, I've seen that most redheads that go gray turn into a beautiful white color. That's most typical, and just from what I've seen.
Yeah, and I think when you get to that white color, it's like it's just spectacular. But have you seen this trend now that these younger models are gray?
Yeah.
Or like a gray violet? Is it over?
Yeah.
It's done?
Heading that way, yeah. Sort of done.
Yeah,
I was like, someone's like, look, you could be gray. And I was like, oh, that looks good. And then I thought, no.
Wait, that makes
No, that means I have to, no, that's not happening.
Right.
Yeah.
There's no in between for that. You know what I mean? That's like a disaster waiting to happen when I decide to go gray. Whatever.
So,
All right.
Suzanne, you will most likely go gray. It may or may not be attractive, but there are options.
Let's hope for that pretty white color.
Yeah.
Yeah, or what's a cornflower yellow? That's also
That's pretty cool too. Yeah, I've seen kind of a mixture of blonde, golden, blondish, and white, which is beautiful. Yeah, redheads are lucky with that.
Yeah. See, Suzanne, you're lucky. You and your coalition, you guys are lucky with the hair. Thank you so much for calling in. We're going to go to Susan from New Jersey. Susan, welcome to Dr. Radio. We have a couple of minutes. What's your question for us?
Hi, thanks. I am calling because I have two little girls who have super, super thick hair, like really thick, and their hair gets so knotty, and, they really give me problems with brushing it, and I'm just, not sure what I could do. Is there anything I could do or use to help their hair be less knotty, or,
Yeah, we get that a lot. You do. It really comes down to the detangling, the conditioning.
Oh, and that brush, there's a detangling brush that seems to work, and there's also a detangling comb.
Yeah.
Yeah.
You don't love that.
Even an overnight treatment, leaving in some oil to make it easier to brush through the next day. You do have to brush it. You have to brush it before you shampoo it.
Yes.
And you have to comb it while she's in the sink to get through those knots a little bit. And you have to use a leave-in detangler.
Have you tried the Tangle Teaser?
What's that? Is that the brushes that have like bristles at different lengths?
No, look it up. The Tangle Teaser is like this handheld little thing, and the teeth of the brush are super, super gentle, and they seem to be a favorite with kids. They can even do it themselves. But I would suggest for sure brushing the hair before you get it wet. That helps a bunch.
Before it's wet?
Yes.
Mm-hmm.
Yes. Yes.
And when it is wet, be careful not to rub the hair with the towel. It's very, very fragile. It's going to get more knotty. It's going to split the ends.
And you'd use a conditioner in the shower, comb it out, or in the bath, comb it out, and then also leave and spray a detangler. I mean, I've done, You know, Susan, I had my daughter and I, this is part of our epic arguments, not even fights, like they just hated having our hair combed. And so I am having flashbacks, and it was really hard. But I found getting her a special brush, having her do it, and then she'd only come to me with the problem stuff. And then I just sit there and pick at it until it came out. But you have two of them. God bless you.
It can become dreadlocks.
Yeah,
so
and they start screaming, carrying on. But I also had really thick hair, and I remember that I would get knots in it that people would spend hours combing through for me. So anyway, good luck. But I used one of those brushes. I used the detangler. The only thing I didn't do is comb through her hair before going in. But I think that is also, if she has a comb in the shower, once they put the shampoo in, they can also do that, comb it through. I think that would be a good thing as well. Susan, thank you.
Coconut oil or olive oil in the ends before they go to sleep is going to make it a little easier to deal with in the morning.
Yeah. And they'll smell like salad. No, I'm just kidding. I'm only kidding. You need vinegar to smell like salad.
I think she wants a salad.
Yeah, I'm actually going to have a salad for lunch, I think. All right, thank you so much, Susan, for your call. Sadly, we are out of time. I want to thank all of our listeners and our callers for joining us. We didn't even get to talk about half the things we wanted to, but we loved answering all your calls. We'll have to have these two back on. Timothy Johnson, Elizabeth Maloy, both stylists at Eve Jarif Salon on the Upper East Side of Manhattan. And from the first hour, Dr. Jason Fung, who has the website idmprogram.com. It should be Dr. Jason Fung or Fung Protocol or something. I got to work on it. I'll send him some of my thoughts. You guys are listening to Dr. Radio. I'm Dr. Marina Curry, and thank you so much for joining me, and we'll be back next week.